Welcome to Gold Coast Plastic Surgery. My name is George Moynihan. I'm the medical director of the Gold Coast Plastic Surgery Cosmetic Institute. Today we'll be discussing Botox Cosmetic, which is essentially a neuromodulator, which is a medical term for freezing muscle function over a period of time. The reason for Botox, for the most common use, is to stop dynamic lines, otherwise known as wrinkles, of the upper third of the face. There are three areas of the upper third of the face to inject, namely the forehead, between the brows, and around the eyes. This schematic of the facial muscles represents the most common placements of Botox. Namely, the three sites that we discussed earlier, which is the forehead, otherwise known as the transverse lines of your brows, the vertical lines between the eyebrows, and the crow's feet, or otherwise known as smile lines around the eyes. The combination of injections can be 1, 2, or 3 sites. When you inject all 3 sites, that is what we technically describe as completely corrected. You are able to combine multiple sites in order to tailor your treatment. Most notably, a very common injection site is what's called the chemical brow lift. The chemical brow lift essentially injects the muscles that lead to downward direction of the eyebrows. The muscles between the brows pull the inside heads of the eyebrow down, and the muscles that create the smile lines ultimately result in the tails of the eyebrows being pulled down. So if one's to inject between the eyebrows and around the tail of the eyebrow and ultimately underneath the tail of the eyebrow, it leads to a lift in the eyebrows. This is a very satisfactory injection. I hope this discussion of Botox has been helpful.